exciting and insightful episode of Me and My Health Up. I'm your host, Anthony Harcher. I'm a clinical nutritionist and lifestyle medicine specialist. Today we have a very special guest, as we always do on the show, and it's Dr. Nancy O'Hara. Dr. Nancy O'Hara is a functional medicine practitioner, and she specializes in Lyme's disease, as well as PANS and PANDAS. And she's got a background where she was helping with autism and ADHD as a functional medicine practitioner. So she not only understands the medical diagnosis, but she knows how to treat it also in a natural way. And we discuss the treatment of Lyme's disease, the prevention of Lyme's disease. We discuss what it is, what to look out for. And we also then go on to have a discussion around what is PANS and PANDAS. So this episode is really for all parents out there that is concerned about their children's health and making sure that they are brought up with a really robust immune system, because all these diseases are associated with a dysfunctional immune system. And we want our children and the future generations to have a robust immune system so they can better tolerate these potential diseases and prevent the onset, or better be able to manage the condition. So without much further ado, I'd love to welcome you into the discussion I'm having with Dr. Nancy O'Hara. Welcome on the Me and My Health Up podcast. How are you, Dr. Nancy O'Hara?
I'm good. Thanks for having me on, Anthony. I really appreciate it.
It's a delight to have you on, an expert in this field that I haven't spoken about on the Me and My Health Up podcast, and it's been going for 5 years. So it's a delight to have your expertise on the show and to really enhance and enlighten the well-being of the listeners around Lyme's disease, which is probably not commonly known about. And we're certainly aware of chronic fatigue and those sort of like things. And yeah, so certainly would love you to enlighten the listeners on this subject matter. But before we get into the subject matter, please share your story as to how you've arrived at what you're doing today.
Sure. You know, I was a conventional physician. I come from a family of 2 doctors. I was in practice, but that was after I had been a teacher. I taught children with autism. And I have to say, and I say this very honestly, I was a really lousy teacher. So I took the easier road and went to medical school. And I was in a private practice, a partner, and I had many children with autism in that practice because I had taught them. I had an affinity for those families. And it was one of those families who said, you know, if you ever do something differently, we need somebody to integrate all of the care of our children. And around the same time, I had been going through about 5 years of infertility, and nothing in the conventional or Western medical world was really helping. And so I found my mentor, Dr. Sidney Baker. Sid is the grandfather of functional medicine in the US, brilliant clinician. And he was the one who said to me, you know, Nancy, if you listen, they will come. And I sat at his feet for 2 years. Within 6 months, I was pregnant with my child. And about 2 years after meeting Sid, started my own functional medicine practice for children with neurodevelopmental disorders, particularly autism, ADHD, etc. And then fast forward 9 years later, I have a wonderful neurotypical son who overnight devolves into seizure-like tics. And I realized that what he had was PANDAS. He developed this right after having strep throat, getting bit by a Lyme positive tick, Borrelia, and getting a viral infection all in the same week. And that took me down the rabbit hole and brought me to what is now my area of expertise, which is PANS, PANDAS, and Tick-Borne diseases. And oh, by the way, I missed one of what we call a Lyme co-infection. You know, Lyme disease is really Borrelia. That's one of the spirochetes that can cause symptoms. But the other one that he had was Bartonella, and I had missed it. And so for all the moms and dads out there that are beating yourselves up for what you don't know or didn't do, you can't know everything until you know it. And then he got mold, and then he got Babesia. So he is my index case of all that I do and all that I try to bring to the children and the families that I take care of. And just another really quick story. I've been coming to Australia for about 20 years, not every year. And this will be the first time since before COVID that I'll be back in a few weeks. But the first time I came 20 years ago, I had a doctor that I was teaching, and I said, she was introducing me to a patient, and I said, oh, that's Bartonella, that's Lyme disease. She goes, oh, we don't have that in Australia. And I'm like, yeah, you do. And she said, no, that's not what it is. This is sensory something, whatever. And I said, no, and slowly but surely, step by step, he was telling us one more sign or symptom. And by the end, she goes, yeah, it's Bartonella. All right, it's here. So I'm still talking about it, still trying to get more clinicians and families to understand it. But I'll keep coming until you throw me out. So
we love having you here, and obviously sharing your expertise at the Mind Foundation Forum coming up in Sydney. So you're really keen to talk more about Lyme's disease, because I was certainly unfamiliar around it, and I visited my friend in Boston in the States, and I was going off on runs, and he's saying, don't go in the forest, don't go in the forest. And being Australian, we love off-road running, and so of course I'd go into the forest, and you go, you didn't go in the forest, did you? And I go, yeah. And he was really concerned, and it was all around tick bites,
right.
and the potential of getting Lyme's disease. So he came from Australia, went to the US, and became very familiar with this tick-borne associated disease, and I was totally naive of it, and it was only really him bringing it to my radar that I become aware of it. So certainly there's plenty of Australians out there that are not across it. And I'd love you to share a bit more about the disease and, I guess the signs, symptoms, and what to look out for.
Yep. So Lyme disease is really caused by one type of spirochete called Borrelia, and particularly Borrelia burgdorferi. And I live in an area of the United States, Connecticut, where Lyme disease was first named. It comes from Lyme, Connecticut, Lyme. But what we've come to learn is that it's not just Borrelia burgdorferi. There are dozens of species of Borrelia, and there are many other infections, particularly from my perspective, Bartonella and Babesia, that can also cause symptoms, particularly neurologic, neuropsychiatric symptoms, and many others, Ehrlichia, anaplasma, relapsing fever, so many of them. So in general, what those of us who are very familiar with Lyme disease would like to do is actually change the way we talk about it to be tick-borne disease or even vector-borne diseases, because the other thing that people don't realize is it's not just ticks. It's also lice and fleas and other, it comes from deer, but also field mice, songbirds. So there are many vectors of this disease, many different types of species that can carry it. So you're right. When we go walking in the forest and outside, we're much more exposed to all these things. But I have to say, in my old practice, there were 30 of us, and 29 of us were active hikers out every day, all the time. One stayed in all the time because she was so fearful of getting Lyme. She's the one that got chronic Lyme disease. So being indoors doesn't necessarily protect you. And in all other facets of life, I think being outside is so important. So I would also like to talk about how you can prevent the tick-borne diseases as well as find them, assess them, and treat them. So maybe first, prevention. If you're going out hiking, wearing clothing that protects you, kerchief around your neck, longer pants, socks, and maybe even putting the socks and the kerchief, soaking them in garlic and cilantro. That really helps. There is a very safe anti-tick repellent called Picaridin that's available in several commercial products, much safer than DEET. And you could also soak them in that. And that can be very helpful. Also, when you get home, do a tick check. Look, and especially the areas that are warmer, moister, like behind your ears, in your groin, or around your belly, where they can get in under your belt, for example, or your ankles. That's why the socks, the kerchief are so important. And even maybe a little belt if you can. In your home, if you have a wooded area or a lot of land, putting 3 foot of wood chips, like mulch, around the perimeter of the property really helps to decrease the entry of the ticks onto the property. So those are simple things that don't require any real repellents of that are toxic to us, or glyphosates for that matter, like we find in Roundup and things like that we want to avoid. And then assessing it, there is acute Lyme disease. So in about 50% of adults, but as little as 20% of children, you may get a rash. And that rash is called erythema migrans. And it's a rash that is usually round, usually with a center that is red, and then around it is lighter, and then a red ring around that. However, it doesn't have to be at the site of the tick bite. It can look very different, especially in areas like behind the ear, behind the knee, in flexural areas or hairy areas. It can look almost just like a hive or an allergic reaction. It can look red. And I'll never forget a child that mom sent me a picture on my phone. I was in the Denver airport in the United States. And she said, they're sending me to the Department of Children and Families because they think I've abused my son because of this lesion. And it looked like a bruise. But I said, that's Lyme disease. And the next day it looked like a classic erythema migrans rash. The other rash that you may see with Bartonella are stretch marks that are blanching. So when you press on them, they change color, and they don't follow dermal lines. Like when you get pregnant, when you've gained or lost a lot of weight, you may have stretch marks, but those usually follow a curve. That's why I'm doing this with my hands. But the stretch marks of the striae is what they're called, of Bartonella, are actually much deeper purple and are either horizontal or vertical. They don't follow dermal lines. So those are the classic skin lesions. Then the symptoms initially, acutely, are often fatigue, malaise, like a summer flu almost. But in the summertime, as opposed to the winter, when you're more likely to get flu symptoms. But the biggest thing we see in kids with Borrelia is brain fog, lethargy, really all of a sudden not getting it like they were. And that's a very classic Borrelia symptoms. You can certainly have joint pains, muscle aches, fibromyalgia, several different things. But in my practice, what I'm really looking at is the neuropsychiatric symptoms. And we definitely see that with Bartonella and Babesia. So the other symptoms besides that stretch mark with Bartonella is rage. The kid all of a sudden or much more chronically will have almost daily rage, aggression, self-injurious behavior. The other thing with Bartonella particularly is sore soles of the feet. So that was something I saw in that child I saw 20 years ago. He was bunching up his socks in the bottom of his shoes, and everybody thought it was sensory. But when you really talked to him about it, he said, the soles of my feet just feel weird. That was Bartonella. And then the other symptoms with Bartonella are often anxiety, sometimes depression. Ticks are very important, or what we call fasciculations. They may just feel trembly inside. They may not have any frank ticks, but they just feel angsty, so to speak. And then the big symptoms with Babesia are night sweating. They soak the sheets, they're sweating so much. Air hunger. They may feel like they can't catch their breath, or they have a constant tick that seems like it's breath holding or a weird breathing. That could be Babesia. In children, it may be also GI symptoms like diarrhea and continual nausea. And then the last one with Babesia is unrelenting headaches. So I always look for these diseases, being in Connecticut, it's always here. 41% of our ticks carry Borrelia, Bartonella, and Babesia. It's not that prevalent in Australia, but it is certainly there and is certainly something we should be looking for if a child or an adult has any of those symptoms.
Yeah, because you also mentioned fleas and lice vectors, can carry these, and we certainly have plenty of animals, that carry fleas, and we have a lot of head lice that go around the schools. My kids were constantly, were battling head lice, and so
but you don't have as much problem with that yourself.
I don't know. They got nowhere to hide. No, I was never worried, but my wife was. She used to. Anyway, all concerned. So when you're describing the signs and symptoms, I can see why this gets so misdiagnosed or missed, because
Yes,
if you're just looking at a few of the symptoms, then you wouldn't even think of these tick-borne
right,
diseases, and you're thinking it's something else, something more common, right?
right.
So what happens over time if this goes misdiagnosed? Do these symptoms evolve into something bigger? Like, is it?
Yes. There was an excellent study out of Denmark of 7 million people, and they found that at least 75% of those who had severe anxiety, depression, suicidal, or homicidal thoughts actually had tick-borne disease in the background. So these diseases, if untreated, the body is this amazing machine. We don't want to be sick. So if you don't get the acute features of the disease, and if it's not diagnosed then a lot of times, particularly with the Bartonella and Babesia co-infections, they'll go deeper. They'll get buried within what we call biofilm or mucus within the body. They'll get buried within other cells, parasites, etc., within the body, so that we're not sick, so that we don't have a fever or the severe pains, etc. But at times of stress or other triggers, like what we saw a lot in this country was COVID, reactivated dormant Borrelia, Bartonella, and Babesia, and then the symptoms came out more. But I implore practitioners, particularly, but also families, that if you have any of these symptoms that I mentioned, to at least talk about it, to at least think about it, because we can get to much more severe issues later, particularly neuropsychiatrically.
And what's the path? So, okay, you end up with the diagnosis. What's the path from that point onwards? Is there potential full recovery, or is it something you live with?
Absolutely. And the other thing I want to say about all these diseases is it's not just about the infection, especially when it becomes chronic, it's about the immune system. And so, what we need to do is support the immune system, provide immune modulatory, anti inflammatory supports, things like turmeric, aloe, modified citrus pectin, not major things. But one of the ways that I have taught several practitioners to treat this disease, as well as families, is herbally. Because when we deal with multiple tick-borne infections, as many of our children may have, treating with antibiotics destroys their gut, may not fully treat every infection they have. For instance, you find Borrelia, you put them on doxycycline. Well, you've missed the Bartonella or the Babesia or one of the other co-infections that may need a different antibiotic or 2 or 3 antibiotics. So there is a lot of research, a lot of good information out there that herbals work very well, even better than doxycycline, cefuroxime, some of the antibiotics in treating these tick-borne diseases. And so I will use herbals, things like cryptolepis, Japanese knotweed, cat's claw. And the advantage of the herbals is, one, they're very safe. Two, they come in liquids. And although a lot of them don't taste great, I do have ways to help that too. But kids can do it and can start with very low dosages and build up as appropriate and treat not just the infection, the microbe that's causing the problem, but also the immune system with the herbals. So I find it a much more fully treating and helpful way of treating the kids without making things in their gut or otherwise worse.
Okay, so it can certainly, the herbals can provide the knockout and get rid of the infection. At the same time, support the immune. So there is an opportunity for a full recovery from.
Absolutely.
Yeah,
It
yeah.
can take time though, especially if it's chronic, a minimum of 9 months. Again, why I like to use herbals. Wouldn't want somebody on antibiotics for that long. And sometimes, depending on the chronicity and the severity, it can take even longer than that. But it is fully treatable.
Okay, and then there's pans and pandas, right? And are they as a result of having Lyme's disease, and it transforms into these pandas? Like, can you just talk a little bit about what is pandas, and how they come about? Because particularly they're picked up in a lot in children, right? I'm not sure about.
Exactly.
Yeah.
So the P in both PANS and PANDAS is pediatric, but it can happen in adults, especially if it's triggered by any of the tick-borne diseases, or mold also, which is a trigger. But PANDAS itself is pediatric autoimmune neuropsychiatric disorder associated with strep. So it's only strep that causes PANDAS. And it's only in 1 in 100 to 200 children. But in those that are susceptible, they get a strep infection, or they get exposed to a sibling or a close contact with a strep infection, and they get symptoms. And those symptoms of PANDAS are OCD, intrusive thoughts, or hoarding, or light switch, on and off all the time, restrictive eating disorder, similar to anorexia, but of an abrupt onset. They all of a sudden are worried about contamination of their food, or choking, or only want to eat a green food or a white food, but very abruptly. And then they also may have tics or anxiety. And if it's together with an abrupt onset of a handwriting deterioration, they all of a sudden can't write, or write very not neatly, or they have a somatic symptom like a urinary change, like a child that was dry at night that all of a sudden is wetting the bed, or a child that has urinary frequency or urgency, or a child that all of a sudden isn't sleeping, or a very restless sleeper. They never get into that deep REM sleep. If they have OCD with one of those and the handwriting deterioration, that's pathognomonic for PANS or PANDAS. Now, PANDAS was first described by Sue Sweeto in the 1990s. And then in 2012, it was just still so controversial. 30 clinicians and researchers got together and sort of made it under a bigger umbrella of PANS. And PANS is pediatric abrupt onset neuropsychiatric syndrome. And that's where they brought in not just strep, but other germs like Lyme disease, mycoplasma, viruses, and other metabolic things like mold, anesthesia, pesticide exposure that could cause an abrupt onset of these same symptoms. The difference with tick-borne disease is it doesn't always have to be PANS. It doesn't always have to be an abrupt onset. It can be a much more indolent, subacute, or chronic onset. So it's an overlapping Venn diagram, but not all tick-borne disease is PANS, and not all PANS is tick-borne disease.
Wow. And I'm just thinking, with everything we've discussed thus far, and you've been very comprehensive, I really appreciate you differentiating them so well and so clearly, is there's like dysfunctional immune system, or not a robust immune system, is really at the heart of all this. Because
absolutely,
yes, I'd love to now drive that discussion back to your very first point around prevention. How can we really support our immune system and the immune system of our kids to really have the best, I guess, first line of defense against these potential infections and onset of these diseases?
Exactly. Well, I don't think the gut is the second brain. I think it's the first brain, and so diet is so critical. I mean, we can start even further back, diet as moms, before we get pregnant, while we're pregnant, making sure our diets are as full of good whole foods as possible, not processed foods, and as much good protein, oils, vegetables, fruits as possible. That's an anti-inflammatory diet. That's an immune system diet. And I'm sure you know even more about this than I do, Anthony, but it really is, in kids, really important to have them eating food. And starting as a mom, when we're trying to conceive, when we're pregnant, trying to eat as healthy a diet as possible, trying to increase our antioxidants, which we mainly get from good fruits and vegetables, but increasing our vitamin A, our vitamin D as naturally as possible, zinc, which we get from our protein, really important. And also all our seafoods, our kids aren't eating many oysters and things like that, but, at least in this country, they're not. And then thinking about how we're delivering. When we deliver by C-section, we increase the risk of dysbiosis, of abnormal germs in our gut. We can counteract that for those moms that need to deliver by C-section with what I call a perineal picnic, where we take the vaginal mucosa from the mom, take a swath of that and rub it all over the baby. There's a great autoimmunologist from Israel, Yehuda Schoenfeld. If you haven't met him, read any of his books, I highly recommend it. And he talks about how he was supposed to do the perineal picnic for his daughter who was delivering by C-section. Now, why a grandfather would be doing that, with his daughter, that's another story I'm not going to attack right now. But he forgot in the emotion of the delivery and everything. And what he did instead was he had his dog Lolly lick all over the baby and give her the germs that way. So, there's a lot of ways to get it. But anyway, it starts with that. And then it starts with, of course, breastfeeding if we can as moms. If we can't, many of your Australian formulas are much better than ours in this country, but still trying to make sure they have good immunity, probiotics, essential fatty acids, and then diet. In this country, what do we usually start as our first food? Rice cereal, fruit. And so we're really increasing those carbs that feed the abnormal germs, the yeast. What do we want to do instead? In my opinion, avocado, vegetables, proteins, really getting those foods in, and a plethora of foods. The baby-led weaning really is about just getting these kids plethora of foods in the first year of life. My claim to fame is that my now 26-year-old son hates sweets, doesn't eat many carbs, and has a diet that is just full of all these good anti-inflammatory foods. And I always wonder, was it because, he had kale hanging out of his mouth and avocado and not the rice cereal and everything else? I don't know. He's my N of one, but I do see it in many of my patients. And so whatever stage of life your children and your family is now, even if you didn't do it before, you can start doing those things now. And that is really important. And then spices too. Turmeric is a spice. Garlic, onions, those are great ways to add anti-inflammatory things into our children's diets without making them have to eat, every vegetable known to man. Get the spices in there, and get the vegetables in the meatball. You're making a meatball, pulverize some vegetables and get them in. You're doing a smoothie. You can put half an avocado in a smoothie and a kid will never know. So there are lots of ways to do that have nothing to do with a ton of nutraceuticals, supplements, anything else. But then there are a lot of nutraceuticals that can be helpful too.
And just on those lifestyle factors such as exercise and sleep.
Yeah. I mean, I talk a lot about, people these days are talking a lot about biohacking and all the ways we can do that, the blankets and the saunas and all of that. I talk a lot about natural biohacking. That's getting outside, forget about the ticks, wear your kerchief and your socks that are soaked, but get out there. The vitamin D exposure, the exercise, the natural sweating is the best way for kids to be healthy. And yes, absolutely sleep. When my families come to see me or I'm teaching another family, I always talk about a 3-pronged approach, which is treating the underlying trigger, if it's tick-borne disease or strep or whatever, treating the immune system. So that's diet and the nutraceuticals, but also treating the symptom. And one of the biggest symptoms people come to me with is nobody's sleeping. If the kid's not sleeping, the parents aren't sleeping. If the parents aren't sleeping, they can't do anything to help the kid. So the sleep is so essential. And it's often the first symptom that I'm treating, that and constipation, because you also have to poop to detoxify. So, those are so important. So the natural things that we can do without spending any money. I grew up in West Virginia, which is a very poor state in the United States. And I walk around with my mouth open at the cost of everything where I live now in Connecticut, including me. But I really try to decrease the costs that our families have to go through. And so the more that you can do naturally, and the other one I just got to say is breathing. How much of the time when we're under stress do we hold our breath? If we just, and it doesn't have to be alternate nasal breathing or box breathing or 8 breaths in, 4 breaths, it can be just taking a deep cleansing breath. And our kids model after us. No offense to all the dads out there, but they are much more symbiotic with their moms. And moms are often, not always, but often the ones on the front lines. And as moms, often, and as dads, I don't want to be too sexist about it, but we don't put ourselves first. We put our children first. And I always remind our parents, that old adage about putting your oxygen mask on first is really true, because and think about it, you're not just doing it for yourself, you are doing it for your child, because they will model the good breathing. They'll model the exercise. If you're sitting inside and tell them, get outside, get out there with them, breathe, sleep, do the yoga, all of that are ways that we can naturally biohack.
Yeah, as you said, it's really simple, and it's just really getting back to traditional ways of doing health without all the fancy terms and everything like that. Just getting back to the basics, as you said, basics with food. Unprocessed food, whole foods, and like a wide variety of foods, and then just getting outside, moving the body, and just breathing. Like these things are and they cost nothing, or
Right.
not a lot, right? It's
Right. And it's just so important. I know parents come to me and they want the magic bullet. They want the medicine or the supplement that is going to fix everything. But you really have to build the foundation. If you don't build the foundation of a house, the walls are going to fall down. And a mentor of mine once said, you always have to go through the door, not the window. And going through the door is actually looking at all those lifestyle things. You jump through the window and go straight to, one of the big treatments for PANS and PANDAS is IVIG, intravenous gamma globulin. You go straight to that, your kid is not going to get better. 1% will, but 99%, you're going to miss everything else that is so foundational and so important.
Yeah, it's so true, because if you don't get those foundations right, then you may sort of, I guess, keep the disease at bay, but ultimately, the healing that needs to happen comes from those change of lifestyle practices and allowing or supporting the body to really heal itself. And I think that you've shared all those key foundations that are really vital for the health of the kid, not only to overcome the initial disease, but for a good life, a good health span there afterwards.
Yeah, absolutely. And it helps everybody, and it's funny, 45 years ago when I was looking for what practice to join, I went to dinner with the group that was the brightest group in all of the area. They were Columbia trained, Harvard trained, Yale trained, brightest group. And I took my husband with me and we went out to dinner. And they were talking about the Oreos and the chocolate milk that they fed their children for dinner because they didn't want to fight with them. And after we left, my husband said, that's the smartest group, and what's so true is that doctors, we get a half an hour of nutrition training in 4 years of medical school and none in residency. Doctors are the worst at talking about lifestyle and diet. Yet it's vital to our health. And, I am very big in any of the conferences I go to that I lead or am on the boards of, we got to walk the walk, not just talk the talk.
100%.
So important.
And you're about to do that in Australia. So please share, what you've got coming up and your Australian visit, as well as your details on how the US listeners can reach out and connect with you and get support, and as how the Australian, or, I guess the rest of the world can also follow you, or, so please
Absolutely. Share. So first about MIND, which is metabolic, infectious, neurologic, digestive disorders, is a group that I've been coming to lecture for in Australia for the last 20 years. This is their 20th anniversary. And we have the conference on May 1st through 3rd. we are doing both community lectures for the general public. I'm going to be giving one on PANDAS, it's called microbes and mental health. Basically the same thing, just different words, post-acute infectious syndromes, whatever you want to call it. I don't care. Just come. We have one of my other colleagues, Dr. Elizabeth Mumper, that's going to be talking about all things COVID. We have one of my other colleagues, Dr. Jim Neuenschwander, who's coming from the US. And in general, we're doing lectures for the community, as well as there is practitioner training. So we're doing our MAPS, which is the Medical Academy of Pediatrics and Special Needs. We're doing our MAPS training there in Australia. So we're bringing it to the practitioners there. So we're doing all the foundation course, sort of the fire hose of everything practitioners need to use in a whole day, and then a whole day of case studies. So that's what we're doing there, as well as trying to raise awareness, doing some think tanks and other things while we're there. And then I'll do a little vacation after that. But then when I get back to the States, all of the things that I have, I certainly have my book, Demystifying PANDAS. It's also available as an audiobook with 5 new chapters on Borrelia, Bartonella, Babesia, mold, and folate receptor antibodies, which is something I just wrote an article on this summer. All of the ways you can reach me, my website is drohara, DROHARA.com. And that has all the information about how you can become a patient here in the States. Though I have to say my waiting list is at least a year long. So what I am trying to do is do more training. And the biggest thing that I'm trying to do is I have a membership program, which anybody, parents or practitioners, can join, which is an annual program. And I have monthly teachings in that, lots of resources, short videos, long lectures, all kinds of things, and then a mentorship. So even if you're in Australia, if you have a practitioner of any sort who would like to learn more and would like to do a mentoring consult with me, you and your practitioner can join me remotely like this and talk. I'm on Instagram, NH O'Hara MD, Facebook, not TikTok, LinkedIn. And I also recently started a podcast, just trying to get the word out. It's called Demystifying PANDAS. So I knew that was more verbose than you probably wanted, Anthony, but I figured I'd get it all in while you were letting me. So
it's all about enhancing and enlightening the well-being of others. That's the whole mission of this podcast, and that's exactly what you've done today, very thoroughly. And and all that follow-up is really important. There's practitioners that listen to this podcast, that there's patients or clients, and and there's obviously the general public. So, and we want to serve all of them. So, and you did that so finely. So I really appreciate you putting aside your valuable time to come on the podcast and to spread the word, so that we're more enlightened in this subject matter that is often missed and misdiagnosed. And so I'm all for supporting you and getting the word out there. So I'll include all those links in the show notes so the listeners can go to the links and click directly on that and connect with you in the way they best see fit. And I really want to just say thank you for coming on, and it's been a delight and honor to meet you, Dr. Nancy O'Hara.
No, I really appreciate it, Anthony. Thank you for inviting me, and thanks for doing this.
Thank you. And to the listeners and viewers, please share it with others. We want to get this out to as many people as possible. So those you think could be, could really do with this information and be of service to them, please share it with them. We'd love to get this word out to as many people as possible. And thank you once again, Dr. Nancy O'Hara.
Thank you.
Podcast disclaimer. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, me&my Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of me&my Health Up.